Hello, my name is Carrie and I am an occupational therapy student at the University of South Dakota. This video was created through the American Stroke Foundation, which is a community program that serves survivors of strokes and their families, and this foundation has several locations surrounding the Kansas City area. This presentation will provide information on what stroke is and how it can affect survivors and their families. In this presentation, I will review the incidence and prevalence of stroke in the United States as of March 2021. I will describe the causes of stroke and discuss how strokes can affect function. I will explain how to recognize the symptoms of a stroke and will list risk factors and methods for preventing a future stroke. I will then describe the roles of the interprofessional health team and will lastly introduce community support systems for survivors of stroke and their care partners. There is a very high incidence of stroke in the United States. According to the Center of Disease Control and Prevention, every 40 seconds someone has a stroke in America. Additionally, strokes are the leading cause of long-term disability due to its multifaceted effects. Many people experience multiple strokes, as almost 1/4 of strokes affect someone who has already had a stroke. As shown in this graphic, strokes were more likely to occur in the eastern south of the United States. Stroke also affects ethnic groups differently, and the CDC notes that those who are African American are at a higher risk of experiencing a stroke than other races. Strokes also commonly affect older adults. However, the prevalence of those who experience a stroke under the age of 65 has increased in the past years. Preliminary data also shows that those who have had COVID-19 may have a greater risk of having a stroke in the future. However, more data is needed to confirm this. In the medical field, strokes are referred to as cerebral vascular accidents, or CVAs. This is because strokes occur in the brain, so that's where they get the word cerebral, and occurs as a result of decreased blood supply to the brain when a blood vessel bursts or is blocked, vascular. The two main types of stroke include ischemic and hemorrhagic. Ischemic is much more common. The American Stroke Association notes that ischemic strokes cause over 80% of all strokes. Ischemic strokes are caused by a blockage in a blood vessel. This blockage is most commonly caused by a thrombus, which is a blood clot, or atherosclerosis, which is caused by a buildup of fatty tissues on the walls of the vessel. On the other hand, hemorrhagic strokes are less common but are much more serious and have a higher death rate than ischemic strokes. A hemorrhagic stroke occurs when a blood vessel ruptures and blood flows into or around the brain. This is generally caused by prolonged and untreated high blood pressure, an aneurysm which is caused by swelling in a blood vessel, or when the blood vessels become tangled within each other. Typically, surgeons attempt to locate where the bleeding originated and then insert a metal coil in an attempt to prevent future ruptures. Strokes affect every person in a different way. How a stroke impacts function depends on what side of the brain and what functional area were affected by the blockage or the bleed. First, we will talk about differences between a stroke on the left and the right sides of the brain. Both right and left-sided strokes will likely impact balance. The left side of the brain controls movements and sensation on the right side of the body, and the right side of the brain controls movement and sensation on the left side of the body. So, if someone has a stroke on the left side of the brain, their right side will be affected. In addition, those with a left-sided stroke typically have difficulties with speech, whether this be processing written or verbal language, reading and writing, or difficulties with speech. Left-sided strokes may cause motor apraxia. This impacts one's ability to organize and carry through motor plans needed to perform everyday movements. Strokes are generally accompanied with cognitive and personality changes, and those who have had a stroke on the left side of the brain may have a more cautious personality. On the other hand, a stroke on the right side of the brain will impact movement and sensation on the left side of the body. Vision is greatly impacted in those with the right-sided stroke. They will likely experience a cut in the left visual field and may even experience unilateral neglect. Unilateral neglect is a severe form of visual neglect, where the person is completely unaware of the left side. For example, someone with this condition may only shave the right side of their face or will draw a clock and place all of the numbers on the right side. Lastly, those with a stroke on the right side of their brain may exhibit increased impulsivity and have a shorter attention span. How a stroke affects function also depends on which area of the brain was affected by the stroke. This graphic provides a nice overview of the function of various areas of the brain. Each lobe of the brain, which is color-coded on this picture, is responsible for a specific function. The frontal lobe is responsible for executive functions, which includes concentration and problem solving. In addition to speech, smell, and motor control as shown in this picture, personality and social manners are also controlled by this lobe. The parietal lobe is responsible for processing the sensory input from your environment, which helps you recognize where your body is in space. The occipital lobe is mostly important for vision, while the temporal lobe is for hearing and also language processing and production. And lastly, the cerebellum is largely responsible for your motor coordination for gross and fine motor movements. Three major arteries supply the lobes of the brain, which are the anterior or frontal cerebral artery, the middle cerebral artery, which is the most common vessel where strokes occur, and the posterior or back cerebral artery. If the blood vessel is unable to supply oxygen and nutrients to a certain lobe or functional area of the brain, that area of function will be most likely impacted by the stroke. For example, if the blockage or rupture affected the posterior arteries, it would most likely affect the occipital lobe, which is in the light green area, and this would likely result in greater visual deficits. So as a recap, how a stroke will affect someone depends on which side of the brain and which functional area of the brain are impacted. Every stroke is different, so understanding where the stroke occurred can help healthcare providers identify the most critical functional areas to address during recovery. It is very important to be familiar with the signs and symptoms of a stroke, as fast recognition and early treatment are the keys for achieving the greatest functional outcomes after a stroke. The acronym B-FAST is a great way to remember the hallmark signs of a stroke. B stands for balance, as many people will feel dizzy or may struggle with walking or standing still. E stands for eyes. Many people who experience a stroke have blurry or double vision. F stands for face. Strokes typically affect one side of the body, so you may see a facial droop on one side of their head. Furthermore, A stands for arm, as one arm or leg may feel weak or experience varied sensation. S stands for speech, as when someone is having a stroke, they may have slurred speech or may be unable to produce words. And then lastly, the T in this acronym stands for time. This is a reminder that if you see these signs, seek emergency care and call 911 as soon as possible. A stroke can be life-threatening, and early intervention is key in stroke rehabilitation, so receiving medical treatment as soon as possible is critical. Time is of the essence immediately after a stroke. The medication TPA, which stands for tissue plasminogen activator, can be given to someone within 3 to 4.5 hours after a stroke to break up blood clots. The sooner this medication is administered, the sooner that blood flow can be restored and potentially decrease lasting effects from the stroke. Even if you are unable to receive the TPA, it is still important to seek medical services as soon as possible so medical professionals can monitor symptoms and create a plan of care to optimize your recovery. Research shows that the most significant gains are made within the first 3 months after a stroke occurs. Therefore, it is very important to receive inpatient or outpatient rehabilitation during this time frame to make optimal functional gains. Rehabilitation professionals will first focus on gaining independence in activities of daily living, speech, balance, fine motor control, and strengthening. As survivors of stroke make progress, therapy may also focus on community living skills, such as home maintenance, financial management, or returning to work skills. Because strokes affect each person differently, every journey through rehabilitation will have different durations, goals, and levels of intensity. After this first 3 to 6 months, progress may not be made as quickly. However, it is always possible to continue to make functional gains after your stroke. Depending on your recovery and insurance, you may be able to continue to go to outpatient therapy or return to outpatient for a tune-up down the road if you experience any decline in function. Additionally, there are many support groups, community programs, and organizations that offer services for survivors of stroke to continue working towards their goals and connect with others who have had similar experiences. It is important to note, however, that after someone has experienced a stroke, they are at an increased risk to experience another stroke in the future. Therefore, it is important to make any recommended lifestyle changes and continue home exercises after discharge to help decrease the chances of another stroke or health condition that could offset any of the gains made after the initial stroke. Strokes can be caused by lifestyle and environmental factors, genetics, or other co-occurring conditions. Smoking, excessive alcohol use, obesity, and lack of exercise all increase one's risk of having a stroke. In addition, if one of your primary relatives, such as a parent or sibling, has experienced a stroke, you may have a higher genetic predisposition to having a stroke yourself. Furthermore, high blood pressure and cholesterol have been shown to increase one's risk of having a stroke. Having diabetes can also increase this risk, especially if this condition is not well controlled, as elevated blood sugars can affect the fortitude of your blood vessels. Cardiovascular disease can also increase your risk, as this also affects blood flow to the brain. A research article published in 2017 noted that an estimated 75% of people who have had a stroke have a cardiovascular disease, and 80% have diabetes or other glucose metabolism deficits. Lastly, early research shows that severe cases of COVID-19 could lead to a stroke, as this may cause your body to form blood clots in the brain. Some risk factors for stroke are preventable, so it is important to be mindful of small habits that you can incorporate into your daily life. Cessation of smoking can increase the levels of oxygen delivered to your brain, decreasing the risk of stroke and heart attack. Limiting alcohol can also decrease these risks. Additionally, monitor blood pressure, blood sugars, or heart rate as prescribed by your doctor to make sure all levels are within normal limits. Contact your doctor if you notice that these levels are higher or lower than normal. Next, try to eat a balanced diet rich in proteins, vegetables, fruits, and grains. Try to limit sodium, cholesterol, fats when possible, as these substances lead to fatty buildups in your vessels. There are many low sodium or no sodium options at most grocery stores. Additionally, there are many recipes online for low sodium diets that are still very delicious. Lastly, getting regular exercise will enrich your cardiovascular health and therefore decrease the chances of a stroke. If you have any co-occurring illnesses, check with your doctor before starting a new exercise routine to make sure that this type of exercise is safe for you. The link provided on the bottom of the screen is to the American Stroke Foundation website. The Life After Stroke tab provides links to various videos that provide examples of seated exercises that can be done at home, further information about the importance of monitoring blood pressure, and also easy, healthy recipes. After experiencing a stroke, a variety of healthcare workers will collaborate to form an individualized plan of care. In the acute and inpatient rehab settings, physicians, pharmacists, and nurses work together to make sure one who has experienced a stroke is medically stable enough to transition to the next level of care immediately following a stroke. Additionally, therapists, case managers, and specialists frequently communicate with the primary care providers to help someone who has experienced a stroke to regain function and continually gain independence. In the next couple of slides, I will describe the roles of members of the rehabilitation team. Many people think that occupational therapists help people get a job. However, OTs defined occupations as things people do every day that are important and meaningful to them. Occupational therapists work to make physical gains, adapt the environment, or make modifications to activities with adaptive equipment to help people gain functional independence. Occupational therapists generally focus on the upper extremities and help people gain fine motor coordination and control using physical agent modalities like electrical stimulation and functional activities like washing dishes, zipping zippers, or opening containers. Across all settings, OTs help people work on activities of daily living, such as dressing, showering, using the restroom, and grooming tasks. Furthermore, as the patient continues to gain skills, OTs can focus on instrumental activities of daily living, which include higher level tasks like cooking, grocery shopping, managing medications, or even driving. Additionally, occupational therapists focus on visual deficits after a stroke and work towards eye-hand coordination, visual scanning, and visual attention techniques. This is a general overview, so feel free to visit the American Occupational Therapy Association for more information on occupational therapy's role. While occupational therapists work on fine motor movements, physical therapists generally work on gross motor movements and focus more on the lower extremities. Physical therapists assist clients in regaining balance in various environments, whether this be sitting, standing, or climbing stairs. Furthermore, PTs assist their clients in gaining functional mobility, planning their movements, and coordinating both sides of the body. This could involve relearning how to move the affected extremity after a stroke and relearning how to walk. When working towards functional mobility, PTs find the best type of mobility aid that will provide the most safety but also the most independence for that person, ranging anywhere from a power wheelchair to a four-wheeled walker to a standard cane. PTs are trained in fitting these aids to each person to promote the best body mechanics. Lastly, PTs assist patients in gaining strength and endurance throughout their recovery. Speech-language pathologists, or also known as SLPs, are also involved in stroke rehabilitation. Cognition is affected by stroke, so speech therapists work towards enhancing executive functions such as planning, memory, and sequencing. SLPs use formal and informal assessment tools to assess cognition, form functional goals, and carry out their plan of care. Several interventions SLPs use include following two-step written or verbal commands or practicing skills in delayed recall. Furthermore, speech therapists help patients further develop their language skills, whether it be through naming familiar objects, completing phrases, or simply working on the motions needed to create specific sounds or words. Speech therapists are skilled in providing indirect cues and instruction to facilitate development of these skills. Additionally, after a stroke, people may have difficulties with chewing and swallowing the food they used to eat. Speech therapists assess their patients' swallowing through observation or through a video swallow study, and then identify dysphagia diets which match the client's current abilities. Dysphagia diets include pureeing foods, softening food, or avoiding really chewy or sticky foods. Speech therapists assist clients in trialing new foods or graduating towards more advanced diets. Speech therapists also teach them strategies for chewing, such as tucking their chin as they swallow, clearing their mouth of food, and swallowing. Occupational, speech, and physical therapists work hand in hand to help clients reach their goals. In many rehabilitation facilities, therapists will have co-treatment sessions to work towards similar goals. For example, an occupational therapist and a speech therapist can work together on eating skills. While the speech therapist will ensure the patient is using proper mechanics for chewing and swallowing and following a safe diet according to the patient's abilities, the OT will be focusing on attention, hand-to-mouth movements, and trialing adaptive equipment that best suits the client's needs. Additionally, therapists play a vital role in team meetings to provide valuable insight into an appropriate discharge plan. Therapists can discuss the patient's progress in therapy and their need for continued care post-discharge, whether this be outpatient therapy, home health services, skilled nursing care, or living in a long-term care facility. I will now describe other healthcare providers that play an important role in stroke recovery. Padberg and colleagues in 2016 noted that social workers and case managers communicate with the patient and their primary caregiver with the aim to assist these people in the process of adjusting to living with a disability and help facilitate the patient's return to the community at the highest possible functional, social, and economic level. In addition, social workers play a vital role in coordinating the transition from hospital or rehabilitation facility to other levels of care, such as outpatient rehab services, home health, or finding a nursing home placement. Social workers also assist families in purchasing equipment for discharge through insurance or through financial assistance programs. Social workers may also assist in working with insurance companies to ensure services are covered. Dietitians may also be involved in your care. They make sure that you are receiving an appropriate amount of nutrition, meals align with dysphagia diets prescribed by speech therapists, and they educate families on diet modifications to be made to help prevent a future stroke. Music therapists work with survivors of stroke to provide emotional support through music. Music therapists provide education on exploring feelings and appropriate coping strategies in group and individual settings. In addition, they also work on visual scanning when reading music, work on articulation through singing, and coordination by incorporating movement with the music. Neuro-ophthalmologists are doctors who specialize in visual changes following a neurological condition. They can assist those who have experienced a stroke in diagnosing any visual deficits they experience and in prescribing home exercises to enhance visual abilities. Physician's job is to manage the patient's medical needs. Physicians assess, diagnose, and create a plan of care for their patients. Many people who have a stroke have other conditions, so the physician is responsible for ensuring that this person's condition is stable and for creating a plan to manage these conditions. Physicians also order prescriptions for needed medications. Pharmacists then ensure that the correct amount and combination of medications are provided for the patient. Pharmacists may also be involved in educating the patient on how to take their medications. Nurses carry out the physician's plan of care by administering the medications and prescribed treatments, assessing the patient's current status and tracking their progress, and caring for the patient's basic needs, such as using the restroom, repositioning in bed, and making sure the patient is comfortable. Respiratory therapists may be involved in your family member's care if they require supplemental oxygen or need to be on a ventilator. Respiratory therapists help people wean off the ventilator, administer medications to assist with breathing, and determine the appropriate levels of supplemental oxygen needed to perform daily tasks. And lastly, recreational therapists are employed by many rehabilitation hospitals to provide patients with opportunities to engage in extra activities outside of their room. This can be on an individual or group basis, and activities range from doing puzzles, playing games, spending time outdoors, or using technology to contact family and friends while in the hospital. After discharge, survivors and their families have to adapt to many different changes in their lives. A survivor may now have to ask for help for things they once could do on their own, or may not be able to go back to work. Their family members may now transition from a spouse, sibling, or child to the role of a caregiver and take on additional responsibilities around the house. Furthermore, you will likely need to make adaptations to your daily routines and environment to ensure the safety after a stroke. This experience can make you stronger and bring you closer together. But no matter if this stroke impacted your life a week ago or a decade ago, these changes are difficult to adjust to. Stroke recovery comes with stress, and navigating these changes can be frustrating. However, you are not alone in this, and there are many resources and opportunities to receive support from others in similar situations. Support groups and Facebook groups are a great place to connect with the community of people who have also been impacted by a stroke, learn more about the journey through recovery, and gain valuable resources from others. The American Stroke Foundation is a great example of a place where survivors of stroke and caregivers alike can come together to receive support. This foundation is a community-based wellness program that is located in the Kansas City area. Their mission is to empower stroke survivors and their families to overcome the challenges of life after a stroke. Whether you have just completed formal rehabilitation or had a stroke 10 years ago, American Stroke Foundation provides a place for survivors of stroke to gain functional skills, exercise their bodies and brains, connect with others, and continue to learn more about stroke recovery. Caregivers are also welcomed to attend sessions and caregiver support groups. The American Stroke Foundation typically offers programming at 4 locations at the Southeast Community Center and Kansas City North Community Center, Sylvester Powell Community Center in Mission, Kansas, and Legacy Park Community Center in Lee's Summit, Missouri. Due to the pandemic, their programming is online as of March 2021, with plans to reopen in-person programming in the future. In offering virtual programming, many educational videos and blogs have been added to their website that can also serve as resources for you in the journey through stroke recovery. This brief video below provides an introduction to the American Stroke Foundation from one of the program coordinators here. If you are interested in being a part of this program, their website and phone number have been added to this slide. Lastly, I wanted to emphasize the positive impact that participation in the American Stroke Foundation has had on the participants here. After being involved in this program, many people have reported improvements in function, including improved speech and balance. Additionally, survivors of stroke and caregivers may feel isolated after experiencing a stroke. However, this program gives participants the opportunity to connect and learn with others. Many caregivers at the American Stroke Foundation have stated that it's so great to see their loved one smiling, involved, and engaged again. Here is a YouTube link of a video of a participant and his wife describing how the foundation has had a positive impact on their lives. Here are the references used to create this presentation. Thank you for attending and have a great rest of your day.